will cover today's breast self-examination. Breast tissue composed of fatty tissue, composed tissue, milk gland, milk ducts. Each breast has 15 to 20 sections called lobes. Normal breast tissue often feels nodular and varies at different times in women to women at a menstrual cycle. Lumps, mass, potential to be dangerous and spread to other parts of body and called as malignant tumor. Women having family history of breast cancer is the highest risk to get breast cancer in future. So here we have to do breast self-examination for every month at the end of the menses. And most important assessment for women, it helps to early detection of breast cancer and unusual changes of the breast. There are total 5 steps of breast self-examination. First 3 steps we are doing for the inspection and last 2 for the palpation. So here we will see what are the 5 steps in detail. Step 1, we have to stand in front of mirror and inspect the both breast. Any unusual changes are there or not. So here we can maintain the 3 posture. One, we can keep the side arm tight and look at the mirror for any unusual changes there, present or not. In second one, we have to raise the arm and inspect any abnormalities there in any breast. Third posture, we have to place the hand on the hip and inspect the abnormalities and unusual changes. Any discharge from the nipple, any tingling, any scarring of the skin, also any color changes of the breast. In step 1, this all the assessment we can do in 3 posture. The next is second step. In this we have to stand in front of the mirror and place the hand behind the head and inspect the both breast, any unusual changes and also counter of the breast. In third step we have to stand in front of the mirror, place the hand in hip, just go slightly towards the mirror and see, inspect any counter changes, any abnormalities. If the next step is step 4. So last 2 steps are for palpation. So here we have to do palpation. In this step, stand in front of the mirror. Otherwise, we can do while bathing also. It means for the first assessment on the left side of the breast, you should raise the left hand and use the 3 or 4 fingers of the right hand and just palpate in a circular motion. So while for the palpating, if any kind of mass or lumps you are feeling noticed, just consult with the doctor. Fifth step of examination. So here we have to do all the 4 steps what we have done. The same procedure we can do in a 5th step also, but here we have to do in a lying position or supine position. For left side breast self examination, you have to keep your left hand on behind the head and keep pillow or folded towel behind the left shoulder and use the right hand finger to palpate in a circular motion. Any kind of abnormalities, lymph node masses present under the skin should consult with the doctor, and the same procedure repeated on right side also. You have to keep the right hand under the head and keep pillow or folded towel under the right shoulder and keep the left hand finger and do the palpation in a circular motion. When we are going to the palpation, that means pay the attention between the area of underarms and breast. So these are the 5 steps you can do every month. So these all are for the today's class. Thank you so much.